One of the biggest promises that the president made when he was touting the grand health care plan was this.
No matter how we reform health care, we will keep this promise to the American people. If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period.
Oh, really? Well, guess what? 7 million people are going to lose their insurance, according to the nonpartisan Congressional Budget Office. That's because it's a lot cheaper for a business owner to pay a fine to the government for not covering their employees than it is to pay for their coverage. So what do you think they're opting for? Joining me now to talk about it is private practice physician Dr. Marcy Zwelling. Doctor, it's good to have you back on the show. Thank you.
Thank you for having me.
7 million people are predicted to lose health care coverage because their employees are just saying, you know what, this doesn't make sense. I could pay $10,000 to cover them, or I could pay a $2,100 fine. I mean, the economics of that are pretty simple, aren't they?
They certainly are. And this was all foreseeable. You know, the Patient Protection and Affordable Care Act is really a political circus, Governor. It isn't about care at all. It doesn't protect patients, and it is absolutely not affordable. And we could have seen this happen. Anybody who read the law could have seen this happen. But then we know they didn't read the law before they voted for it. And in fact, they thought they had to pass it in order to read it. That was a tragedy. So now we have this political circus. And quite frankly, humans are doing what humans would do. A man who owns a business wants to keep his business viable. That just makes perfect sense. And when the cost of insurance would put him out of business, well, he has no other opportunity than to drop the insurance. And of course, as you know, theoretically, these people will be able to buy insurance on an exchange if they can afford it. That's yet another problem. And I would say that while the CBO came out with a figure of 7 million losing their insurance, you ain't seen nothing yet. I would suggest that millions and millions more will be losing their insurance, and those that will lose it will probably find it very difficult to afford to buy it themselves.
You just hit upon something I think a lot of people have never thought of. If their employer doesn't provide it, and the employer might not because the business is under 50 employees, so they don't have to. A lot of employers are saying, well, we're not going to let anyone work over 30 hours. Then they don't have to provide it. But the individual is still required by law to have it, so now they have to go out in the marketplace and get it, and the law says they can't be without it. I mean, this is, I think, a piece of this people hadn't thought about. Yeah.
A human tragedy. And sadly, the poorest among us are going to be hurt the worst. You know, people make decisions that usually are pretty intelligent. The American citizen, pretty smart person. They know how to run their lives, and quite frankly, they should be able to make those decisions and make those choices. Many of them have made a choice to buy their children milk, to send their children to college, and have decided to not buy insurance. Now, their insurance will be even more expensive, and they'll be less likely to be able to afford it. But now they have to pay a penalty. So life gets a lot more expensive, and they sure as heck don't have anything for it. And I would venture to say that when you look at this plan, remember, it's not insurance that these people are having to buy. They're buying a benefit package. So the poorest among us are buying fertility coverage for themselves and for their neighbor when they really don't want to buy that. We could, however, have a catastrophic plan. That's yet a different subject. But this is not about insurance, Governor. This is about a benefit package, a huge, unaffordable, bankrupting benefit package that, quite frankly, no one will be able to afford. In fact, last night I was talking to one of my patients, my own patient, who was telling me that she had talked to her insurance company just the other day, and she was warned that her $700 per month insurance policy, pretty expensive, is going to $2,000 a month in 2014.
Unbelievable.
$2,000. Unbelievable. Who in your audience can afford that? No.
No, they can't. And I think that's what people are, the rude awakening. I want to talk about what people in Congress are beginning to think, and maybe there's some issues. And also to ask our audience, are you having problems getting an appointment with a doctor that you really want to see, that doctor that the president said you could always go see? Well, what's happened to the quality of your health care under ObamaCare? We'll talk about that with Dr. Zwelling when we return. We're back with Dr. Marcy Zwelling. Let's talk about the quality of care under Obamacare. Will it get better, or will people find it harder to see their doctor?
people are finding it already harder to see their doctor. The average wait, at least even in California, my patients are telling me that they're having to wait 4 months to see a doctor. One of my friends in Massachusetts, under ObamaCare, called for an appointment for a pap smear. She was given an appointment 11 months away. Talk about finding it difficult to see a doctor. You know, the whole doctor community has changed. Many of us in private practice, I'm sad to say, have decided to join hospital practices where, quite frankly, they now are working for a hospital. Direct conflict of interest, not a good thing. And these people are now 9 to 5, not 24/7. You know, as a doctor, I work 24/7. I am available for my patients. There is nothing about healthcare that is good about an insurance card unless you have a doctor. You need to have a doctor, somebody to call. Not to stand in line in an emergency room, but somebody to call. And most of these doctors are now not available at the end of a phone like they used to be. They're not in private practice. They're working for an insurance company or a hospital. Waits are long. And that whole thing about a relationship, well, that's just gone. And you know, everything good about a doctor-patient relationship is about better care. Better care requires a doctor who cares about you. You need to have a doctor, not a name on a card, but a person at the end of a phone, someone you can call, someone you trust.
Do you think some people in Congress are beginning to realize what a mess they've made of the health care system? Democrats as well as Republicans, who, by the way, didn't vote for it, but still. Any hope that you see as you talk to members of Congress that they might want to change some things?
Indeed, I have seen some hope. The IPAP, the Independent Payment Advisory Board, there is actually co-sponsorship to repeal that. I'm seeing some hope to maybe repeal the device tax, another foreseeable problem. You know, all these device companies have decided to move offshore. They're firing people and they're not developing research like they used to.
And Dr. Zwelling, I want to make sure that our audience understands when you talk about the device tax, that's everything from braces on your kids' teeth to being able to have a walker or a wheelchair or a colostomy bag, anything. And there's a tax for having the device. I've never understood that one.
Indeed, it's a 2.3% tax on total revenue for everything over $100. That tax, of course, will be passed on to the consumer. It is really, talk about unaffordable. It is totally unaffordable, unaccessible. And again, I have to stress that good care is about having a doctor-patient relationship. Everything good that happens in my office happens between a doctor and a patient. And as I said the last time when I was on your show, the government just does not belong in the room. There's nothing about the government, their processes, or their paperwork that makes for good care. And I might add that given your last segment about cyber hacking, imagine when your electronic medical record goes across to the government and someone hacks into your most private life. Everybody's medical record is now accessible to the world. That is just wrong. It's personal, it's private, it's built on relationships, not about government bureaucracy. And I think the Dems are starting to see that as well. You know, no Republican voted for this bill, and there were a lot of Democrats who did. I think even in the Senate, you know, Evan Bayh, who was a senator from Indiana, now works for the medical device companies, and he's actually asking Congress to repeal that tax. So indeed, we have seen it happen. I think the Dems are getting smart, and you know, they're going to have to wait in the same lines as everybody else. So give them an opportunity to wait in line in an emergency room. And by the way, I was in my emergency room that sits right outside my office, and I was there the other night. The lines are out into the hallway. There wasn't even enough chairs for the patients. Older people waiting 10 and 12 hours to see a doctor with whom they don't have a relationship. Not good care, Governor. Not good care.
Dr. Zwelling, that's one of the reasons we love having you and hope to have you back. You just make it very clear, but also scare the daylights out of us. So thank you for being here. It's a pleasure to have you.
There is hope. There is hope.